What causes hearing loss? What causes hearing loss? It's not just loud concerts or aging. Hearing loss can be triggered by various factors. Aging, the common cause known as presbycusis, where gradual hearing loss happens as we get older. This we discussed in previous video. For link, check the description. For more insights on age-related hearing loss, we have discussed this in previous video. Please check it out by following the link in the description below. Noise exposure. Repeated exposure to loud sounds, whether at work or through entertainment, can damage the hair cells in your inner ear. Ear infections and diseases. Conditions like otitis media, meningitis, and even diabetics can lead to hearing problems. Medications. Certain drugs called ototoxic medications can affect your hearing. Injury, trauma to the head or ear can result in permanent hearing loss. Understanding the cause can help guide the solution. But how do you know if you are experiencing hearing loss? Symptoms of hearing loss. Hearing loss doesn't always happen overnight. It can sneak up on you slowly. So pay attention to these key symptoms. Frequently asking people to repeat themselves, difficult hearing in noisy environments or group discussion or group conversations, feeling like others are mumbling, needing to turn the TV on or radio volume up higher than normal. Ringing or buzzing in the ears, difficulty hearing, asking to repeat, volume increase, tinnitus. If any of these sounds familiar, it might be time to consider a hearing test. The impact of untreated hearing loss. Untreated hearing loss can do more than just affect your ability to hear. It can impact your mental and emotional health, social isolation, missing out on conversation that lead to withdrawal from social activities, cognitive decline. Studies show a strong link between untreated hearing loss and cognitive issues like dementia. Emotional stress, frustration, embarrassment, and anxiety often accompany hearing loss when it's left untreated. But there is hope. With early detection, you can take control. What should you do next? If you think you might be experiencing hearing loss, the first step is simple. Get a hearing test. A hearing test is quick, non-invasive, and gives you a clear picture of your hearing health. Diagnosis of your hearing loss. How is hearing loss diagnosed? The process is simple and often involves different types of hearing tests performed by an audiologist. Audiometric testing. This includes pure tone audiometry, speech audiometry, and tympanometry to assess the time and degree of hearing loss by an audiologist. Medical evaluation. A thorough examination by an ENT specialist to identify underlying causes. Number 1. Pure tone audiometry. Purpose. Pure tone audiometry is a primary method used to assess hearing sensitivity across a range of frequencies. It helps to determine the softest sounds a person can hear, known as the hearing threshold, at various frequencies. Procedure. This test is performed in a soundproof room, typically using headphones or insert earphones. The audiologist presents pure tones at various frequencies, usually between 250 Hz and 8000 Hz, and intensities measured in decibels dB. The patient is instructed to signal, often by pressing a button or raising a hand. When they hear a tone, no matter how soft, the audiologist adjusts the loudness of the tone to determine the quietest sound the person can reliably hear at each frequency. Bone conduction testing may also be performed using a small vibrator placed behind the ear on the bone to assess the inner ear directly, bypassing the outer and middle ear. Significance: this test identifies the degree and configuration of hearing loss. It provides information about whether the hearing loss is sensory neural, inner ear, or auditory nerve damage. Conductive: problem in the outer or middle ear, or mixed, a combination of both. For example, high frequency hearing loss is common in age-related hearing loss, presbycusis, while low frequency loss may indicate other conditions like Meniere's disease. Number 2. Speech audiometry. Purpose: speech audiometry measures a person's ability to detect and understand speech rather than just pure tones. Since speech is composed of various frequencies and complexities, this test gives a more real-world perspective of hearing ability. Procedure: the audiologist presents a list of words or sentences to the patient through headphones or speakers at different volumes. There are two main components to speech audiometry: speech recognition threshold, SRT, the softest level at which a person can correctly repeat 50% of spoken words. Word recognition score, WRS, a percentage score representing how well a person can recognize and repeat words spoken at a comfortable loudness level. This test may be performed in both quiet and noisy environments to stimulate real health listening conditions. Significance: speech audiometry is crucial for understanding how hearing loss impacts everyday communication. It helps differentiate between hearing loss that affects speech clarity versus loss that only affects volume detection. Poor WRS results in the presence of good pure tone threshold might indicate retrocochlear pathology, such as an issue with the auditory nerve or brainstem. Tympanometry. Purpose: tympanometry evaluates the function of the middle ear, including the eardrum and the ossicles, small bones in the middle ear. It measures how the eardrum responds to changes in air pressure and provides valuable information about middle ear conditions. Procedure: a small probe is inserted in the ear canal which emits a tone and changes air pressure inside the ear. The probe measures how much sound is reflected back from the eardrum as the pressure changes. The results are displayed on a graph called a tympanogram, which shows how flexible or stiff the eardrum is under different pressures. Significance: normal tympanogram indicates a healthy eardrum and a middle ear with normal pressure and mobility. Flat tympanogram, type B, may suggest fluid in the middle ear, common in middle ear infections or otitis media, a perforated eardrum, or a malfunctioning eustachian tube. Negative pressure tympanogram, type C, often indicates eustachian tube dysfunction, which could be caused by allergies or congestion. Hypermobile tympanogram, type AS, may include a highly mobile eardrum, potentially from a heel perforation or a weakened eardrum. Stiff tympanogram, type AD, may suggest problems with the ossicles such as autoclerosis, where the bones are fixed and less mobile. Tympanometry is particularly used in identifying conductive hearing loss caused by issues in the middle ear, which often be corrected with medical or surgical interventions. Treatment options for hearing loss. So what if you already noticed some hearing loss? Treatment can make a world of difference. Hearing aids. Modern hearing aids are discreet, advanced and designed to fit seamlessly into your life. Options include RIC, receiver in canal, comfortable and nearly invisible. CIC, completely in canal, a great option for those who prefer a very discreet device. Cochlear implants, for those with more severe hearing loss. Cochlear implants can be a life-changing solution. Assisted listening devices, from amplified phones to TV listening systems, these can help improve your daily communication. The key is to find the right solution for you. That's where your audiologist can guide you. The benefits of treating hearing loss. Imagine getting back to fully enjoying conversation with friends and family. That's the power of treating hearing loss. Improved communication, better mental health and emotional well-being. A return to the social activities you love. And most importantly, a better quality of life. Coping with hearing loss. Coping with hearing loss isn't just about hearing aid. It's also about lifestyle changes that can improve your quality of life. Communicate clearly. Speak openly with friends and family about your hearing challenges. Visual cues. Rely on visual information like lip reading or subtitles to assist in communication. Hearing rehabilitation. Therapy can help retrain your brain to process sounds more effectively. Support groups. Connecting with others who have hearing loss can help with emotional support and practical tips. Myths and realities of hearing loss. There are many myths about hearing loss. Let's clear up a few misconceptions. Myth number 1. Hearing loss only affects older people. Reality. Hearing loss can happen at any age, including childhood. Myth number 2. If you can hear some sounds, your hearing is fine. Reality. Even mild hearing loss can impact communication and daily life. Myth number 3. You know immediately if you have hearing loss. Reality. Hearing loss often develops gradually and may go unnoticed. Myth number 4. Only severe hearing loss needs treatment. Reality. Hearing aids can help with mild to severe hearing loss. Myth number 5. Hearing loss in one ear isn't a big deal. Reality. Even unilateral hearing loss affects sound localization and balance. Myth number 6. You can self-manage hearing loss without professional help. Reality. Untreated hearing loss can worsen and professional care is essential. Loud noise is the only cause of hearing loss. Reality. Hearing loss can result from various factors including infections and certain medications. Take the first step and here's up. We are here to help you every step of the way. From comprehensive hearing tests to expert guidance on the right treatment, we make sure your hearing health is in good hands. Why choose HearsApp? At HearsApp, we believe that everyone deserves access to the best hearing care. Here's why you should choose us. Expert audiologists. A team of skilled audiologists is here to help with personalized care and advanced solutions. State-of-the-art technology. We offer the latest hearing aids and diagnostic tools to ensure you get the best possible treatment. Comprehensive care. From diagnosis to treatment and ongoing support, we are with you every step of the way. Trusted by customers. HearsApp is a customer-trusted brand known for delivering top-notch care. Hear better, live better. Take the first step today. Visit Hears App for a consultation and start your journey towards better hearing. Thank you for watching. Like, comment and subscribe for more hearing related information from Hears App. See you in the next video.